Today we're looking at something pretty serious happening in Taiwan. It's about the emergency care system. Things seem really strained.
Yeah, very much so. We're seeing reports. One key one we looked at paints a picture of, well, overcrowded emergency units and patients facing longer waits for urgent help. It's concerning.
Right. So our mission today is basically to get to the bottom of why this is happening and, what solutions are on the table. Give everyone a clear view.
Exactly. Understanding the core issues and the potential fixes.
Okay, so let's start with the problem itself. These packed ERs, the long waits.
hmm
What's the main driver?
Well, the Taiwan Society of Emergency Medicine points pretty clearly to one thing: a shortage of hospital beds. Just, not enough beds available when people urgently need them.
So the emergency departments are literally full. No space.
Essentially, yeah. They're running out of room to treat patients quickly.
But it's not just about the physical space, is it? I remember reading something else was involved.
That's right. You've got the bed issue, but then there's the nursing shortage. It really makes things worse. Even if a bed is technically free, without enough nurses, well, you can't actually use it for care.
Ah, okay. So they're linked. No nurses, no usable beds, basically.
Precisely, it creates this major bottleneck.
Okay, so given this bottleneck, what are the immediate ideas? The short-term fixes being talked about.
There are a few main ones. First, being able to open up more general hospital beds quickly. When there's a surge in ER patients, having that flexibility.
Right, like an overflow valve almost. What else?
Making sure the critical care units, the ICUs, are used efficiently.
Yeah.
Really ensuring they're for the patients who absolutely need that highest level of intensive care.
That seems sensible. Prioritization.
Yeah.
And speeding things up for patients already in the ER.
Yeah, that's crucial too. Increasing the number of doctors and nurses right there in the emergency departments, just more hands on deck to assess people faster, get treatment going.
hmm
And there's also talk about a better patient referral system.
Referral system. How would that work?
Well, sort of guiding patients. Like if someone has a less severe issue, maybe directing them to a local clinic instead of the main hospital ER. Frees up those emergency resources for the truly critical cases.
Okay, so tackling capacity and patient flow. Got it. Now, thinking longer term, this needs more than just quick fixes, right?
Absolutely. For lasting change, the report really stresses better coordination between hospitals.
Ah, so they work together more.
Exactly. Share the load, basically. Distribute patients more evenly so one place doesn't get completely swamped while another might have capacity.
That sounds like it requires some system-level changes. What about the money side? Insurance.
Good point. Changes to public health insurance policies are definitely being looked at. The idea is to better support emergency care financially, maybe incentivize hospitals to invest more in their ERs.
And potentially reduce the need for hospital stays in the first place.
Right. Expanding home care options is another angle. If patients can recover safely at home with support, that eases the pressure on hospital beds overall.
And knowing where the beds actually are available seems fundamental.
Totally. Establishing a system, maybe real time, to track bed availability across all the different hospitals. That would help allocate patients much more effectively, manage transfers better. It's about connectivity.
So a lot of potential solutions, both short and long term. How's the government responding to all this? Are they stepping in?
Yes, they are. The health minister, Taiwan, is reported to be actively working on it. Hospitals are apparently already in the process of hiring more medical staff, trying to address that shortage.
Hiring is one thing, but keeping them is another, especially in demanding ER roles.
True, and the government is considering raising wages. That's often a key strategy for retention in healthcare.
Makes sense. What else is part of their response?
There are also public awareness campaigns underway, trying to encourage people, if you just have mild symptoms, maybe visit a clinic first, not rush to the ER.
Right, trying to manage demand from that side too.
Exactly. It's a multi-pronged approach aiming for, well, real lasting improvements across the board in emergency care.
Okay, so let's try and wrap this up. It sounds like Taiwan's emergency care is under serious pressure bed shortages. Staffing issues are the big ones.
Definitely the core problems.
But there's a whole range of solutions being tried or considered. Quick fixes like flexible beds and better referrals, plus longer-term stuff like hospital coordination, insurance tweaks, and home care.
And the government seems actively involved, pushing hiring, looking at wages, managing public expectations.
It's clearly a complex situation needing a lot of coordinated effort.
No easy answers, that's for sure.
So here's something to think about as we finish this deep dive. We've talked about the immediate pressures, the shortages, but what wider societal factors might be feeding into this strain on emergency services? Think lifestyle, demographics maybe? And looking ahead, How much could a stronger focus on preventative health care actually alleviate some of this pressure down the line? Just some food for thought. Thanks for joining us on the Deep Dive.